Hey guys, Dr. Pete here, and today we are with Alexis. It's been a while since we've made a video, and I wanted to just share kind of what we're doing in the office, remind you guys the purpose of chiropractic care, what it can do for you. Now, Alexis, you've been coming to the office for a while. Currently, your schedule is you come every 2 weeks, and how far is your drive to come for your visits right now?
So I drive an hour and 15 minutes to come all the way here.
That's pretty cool. Now, you don't have to drive an hour if you live far away to come see me. There's a lot of chiropractors, I'm sure, where you are that can get you the care you're looking for. But you drive, you got your little baby in the car seat in the back. But so obviously it's worth it for you to come. So will you just share with our viewers like what you see the value is for you?
Sure, yeah. For me, chiropractic care is like the one-stop shop. I feel like if I'm getting adjusted, my body is healthy, my mind is healthy, I'm just functioning better. So that way I don't necessarily have to go see a doctor. If something comes up, I'm already getting good care because I'm maintaining my health over time. So to me, it's always worth it to get adjusted.
That's awesome. And I think, there's a couple of things there. One is that in those, right now, if you come in every 2 weeks, if something happens and you strain your neck or your back, we can deal with that. And then of course there's a preventative aspect. So that's really what I'm gonna get into now. So what we're doing when someone comes, at least with what I'm doing here at my office, is we're checking the movement of the spinal joints. Sometimes we might check shoulder and hip joints, but we want, with any joint in the body, the thing that the joint has to do to be healthy is it needs to move. So when a patient comes in for their checkup, then I'm basically, it's called palpation, feeling the spine, seeing where some joints are basically stuck or not moving correctly. Then I'm going to make an adjustment, and that's going to basically comprise the patient's visit. And then we have patients doing some exercises at home to keep their joints moving and their spinal joints moving in between visits. So the idea here is that if you keep your joints healthy, they're going to last a lifetime. Why would that be valuable to you? Well, one reason is to avoid pain and stiffness. So, for a lot of people, for instance, you get up and if you have a desk job, we'll talk about the neck. You look straight ahead, you might turn your head a bit to the left, a bit to the right, and that's it. So what happens is the joints in the neck here really don't move through their full ranges of motion, and over time, years, they start to deteriorate or degenerate, and then we get stiffness, we get pain, and then that's a lot of time when people show up here is when they're 40 or 50 or 60 and they say, I need help, I can't golf properly anymore or drive properly anymore because I can't turn my head and it hurts a lot. And we want to really think of the dental model and think about caring for our spinal joints before they become painful and degenerate if possible. So we're going to show you Alexis's checkup and adjustment. So we will start with you lying face down. There's a lot of different ways to adjust the spine. Basically, again, the goal here is to, where we find things that aren't moving, to get them moving with the chiropractic adjustment. This is a manual adjustment you're going to see here. There is also drop table. There is also instrument adjusting, which can be done for people that we need to use a more gentle technique, or they're maybe, even afraid to be adjusted manually. So we'll look at that. So here we go. So I start off bottom, sacroiliac joints, and just palpate. The left side is moving really nicely. Right side, not moving too well. So that's the first adjustment we're going to do today. So I'm going to have our camera person, just come on over here, and I'm going to step around. Great. And Alexis, let's have you on your side facing me, please. Here we go. So again, there's a joint here, sacroiliac joint. I'm putting the force in there to get that joint moving better. So here's how that looks. Well, moved already. Just when I kind of moved it into place, you felt the click.
Yeah.
Okay, now let's go face down one more time, please. So I'm going to come back and then continue my checking of the spine as we go here. So back down, both SI joints are moving really nicely now. Really common area where the spine loses its mobility is the thoracic spine between the shoulder blades. from sitting, from driving, from lack of movement of this area of the spine. So we've got to do an adjustment there with Alexis right there. So let's have you, I like to do this one, well, one good way to do this one is with a patient lying on their back. So let's have you flip onto your back. And take a breath in, let it out. Great. Good. Now we're going to move on to the neck. So why don't you come back up to sitting, actually, so you're like over that. Come over. So now I'm going to palpate her cervical spine and see how, so starting at the base of the skull and feeling how the C1, C2 vertebra move, and they're moving pretty well with Alexis. In this area, if we have the spine is not moving well, a lot of times they're going to have upper neck pain and headaches happening. So hers is moving well. She's taking good care of her spine, as we know. But we do have some restriction at the base of the neck. Now this could be in through this area, sleeping again, sitting posture. Sometimes the way we sleep, our neck can get kind of tilted and we can get some irritation there. Can also be to workout activities people do, or carrying a heavy car seat. You were just thinking that. You read my mind, or I read yours, or something like that. Okay, so a really nice way to do this adjustment, again, there's only one way to do it. There are different ways, but we're going to do it in the chair. So come on over to the chair with me. Our camera person will follow around. Good. So, and again, I'm trying to target movement in the particular joints that aren't moving. So in this case, on the right side, it's where the first rib inserts to the base of the neck. So I'm using my fingertip to just get movement there. A little bit. There we go. Very nice. Is this blocking? You're good?
No, I'm good.
And on the other side, a little bit. Great. That was comfortable?
Yeah.
Felt good?
Yeah.
Great. Okay. So we're going to go back to the table. You can sit over there. Just grab a seat here. So last thing we're going to do now, so Alexis has been adjusted. She's had all those segments that were, and joints that were kind of locked up. We've got them moving again. So now she's going to go off for 2 weeks and live her life. We want her every day to be moving those joints to keep them healthy and mobile and pain-free. So I'm going to just demonstrate with Alexis her exercise. Now, I don't really want you guys to do this at home if your neck has not been assessed by a professional, because you want to know basically what kind of shape you're in before you're forcing your neck into ranges of motion that might be painful, or where you might have joint problems that really you want to address the joint problem first before you have the patient, or before you do the exercise. So what we're going to do, so to start, to take this neck through the range of motion, you're going to look down and basically go as far as you can so your chin touches, yeah, great. Now she's going to turn her head, so dragging your chin across your collarbone, far as she can go. Now the ear tips down to this side, and now she rotates. Oh, hair's in the way. Looking up to the ceiling. Tip the ear down, and chin back to the middle, and look straight ahead. So that's basically a big neck circle, but between each of these vertebrae, there are joints. They're called synovial joints. They're like the shoulder joint or the hip joint. They're two bones coming together. It has a capsule around it and fluid inside. And when she does this rotational movement, all those joints move and get lubricated and bring fluid in, which, again, a movement like that, you're probably never doing in your day-to-day activities unless you're doing a specific exercise like this, but it's going to help keep those joints alive and healthy and mobile. So that's an example of some of the exercises we might give a patient for the neck, the cervical spine, to keep it mobile, to keep it pain-free. Again, once we have corrected any joint problems that we found. So that's the story. Anything else you want to share? Okay. Hope you found it educational. Hope you learned something. If you have any questions, certainly in the comments you can do that. I'm Dr. Pete Andrelli. I'm at 2012 Victoria Avenue in Burlington, Ontario. And I'd love to help you, but of course there are chiropractors in every community that can do the same for you. So thanks for watching, and we will see you on the next video.